Good morning. I'm Dr. Samuel Pang. I am a physician at Boston IVF, and I have been asked to talk to you about reproductive options for transgender people. Um, there's a lot of different things that we can talk about, but I'm going to start with talking about options for transgender women because that appears to be a little bit simpler. There are two basic options, and one is to bank sperm before transitioning. And when transgender women bank their sperm, we strongly recommend that they do that prior to starting hormone therapy because taking hormones can suppress sperm production. So we do recommend that banking sperm occurs prior to starting estrogen therapy. Now, once the sperm is banked, how can the sperm be used in future? Well, how the sperm is used in future really depends on what type of relationship the transgender woman is in. If she is in a relationship with a biological or cisgender woman, the sperm can be used to do intrauterine inseminations or IUI. And if that's not successful, then her cisgender partner could do IVF using the frozen sperm. If the transgender woman is in a relationship with a biological or cisgender man, then they would need to use an egg donor to do IVF and a gestational surrogate to conceive. Now, the other variable is the numbers of sperm that are frozen. If the numbers of sperm are good and there are multiple vials of sperm frozen, then the sperm can be used for IUI. And if pregnancy is not resulting from the IUIs, then using the last remaining few vials of frozen sperm, IVF can be done. However, if the sperm numbers are very low to begin with, IUIs may not be an option. And IVF may have to be resorted to immediately. As an example, I am now seeing a couple in my practice where the transgender woman had her sperm frozen several years ago. She's now in a relationship with a biological cisgender woman. And so we're planning to use her sperm that was previously cryopreserved to achieve pregnancy in her cisgender woman partner. However, the numbers of sperm that were cryopreserved several years ago are extremely low, and because of that, they don't have a choice but to go directly to IVF. If her sperm numbers had been better, they might have been able to attempt a few IUI cycles before resorting to IVF. So to summarize, bank sperm before transition, preferably before starting hormones, because hormone therapy will suppress sperm production. And how the sperm is used afterwards depends on the sperm numbers and also depends on what type of relationship the transgender woman is in at the time that she is planning to use her previously frozen sperm. Now, moving on to transgender men, again, there are several different options. The most common option is to bank eggs. So egg freezing is something that we have been doing for a little over 10 years now. And for almost 10 years now, I have been seeing transgender men who come in to bank their eggs prior to transition. Some of the transgender men come in before they begin hormone therapy. And that's ideal because we can just go ahead and stimulate the ovaries, retrieve the eggs, freeze the eggs, and then they start testosterone therapy. However, there's some of these patients that I've seen who have already started testosterone therapy. And in these transgender men, what we have done is to discontinue the testosterone therapy, do the egg banking cycles, and then they can resume testosterone therapy after their egg banking cycle. Another option is to bank embryos. If the transgender man is in a relationship with a known partner who has sperm, meaning a biological or cisgender man, we can use sperm from the known partner. If the transgender man is in a relationship with a cisgender woman or somebody who does not have sperm, then we would have to use donor eggs to create embryos. And that is something that I have also done. A case in point is a transgender man that I treated several years ago who was in a relationship with a cisgender woman, and so they needed to use donor sperm to achieve pregnancy. That particular case that I talked to you about, the transgender man intended to carry a pregnancy himself, and so he underwent IUIs with donor sperm, did not conceive, and then ultimately underwent IVF with his own eggs using donor sperm and carried a pregnancy himself, and ultimately came back and carried a second pregnancy himself as well. So those are all options that are available. Alternatively, he could have banked embryos, gone through the IVF process, created embryos, frozen them, and then depending on what his relationship status is later, the frozen embryos could be used to achieve pregnancy with a cisgender woman partner or with a gestational surrogate, depending on what is available and what his relationship status is at the time that he's planning to use his frozen embryos. I have also treated a single transgender man who attempted to conceive himself with donor sperm and IUI, and when that was unsuccessful, he then went on to do IVF and is now pregnant, carrying the pregnancy himself. So that is also an option for people who are planning to have children themselves. They can either bank embryos, or if they are ready to have children right away, they can go ahead and get pregnant themselves, either with IUI or with IVF. Now, for those transgender men who have banked eggs, and that's actually the majority of people who, patients that I have seen, they have not come back to use their frozen eggs yet. Now, how can they use their frozen eggs? Again, it really depends on what their relationship status is at the time. If they are in a relationship with a cisgender or biological man, then they can use sperm from their partner to create embryos, but they would need to have a gestational surrogate carry the pregnancy. And if the transgender man is in a relationship with a cisgender woman, then the frozen eggs could be inseminated with donor sperm, embryos created, and the embryos can be transferred into the uterus of his cisgender woman partner who can carry the pregnancy for him. So to summarize, the options for transgender men are to bank eggs or to bank embryos, or to go ahead and achieve pregnancy himself if he is ready to be pregnant. If he is banking eggs or banking embryos, then how those frozen eggs or frozen embryos are used later will depend on what his relationship status is at the time that he's ready to use those frozen eggs or frozen embryos to achieve pregnancy. So that's a summary of the various options, various reproductive options for transgender people. Thank you for listening.